All right, so everybody, it's so good to see you all. I'm going to go ahead and mute everyone, but thank you so much for coming, and we invite each of you all to let us know if you have any questions throughout. But I'm going to kind of go through this. If you don't know me, I'm Ashley Pleshay. I'm the Senior Director of Brand Marketing, and we're really excited to have you with us, especially on such short notice. So, we're here because we want to talk about the competitive bidding program proposed rule. It's a direct threat to the HME industry and importantly to the people that we serve every day. So if this program moves forward as proposed, it's going to have a devastating impact for everyone who needs HME, supplies, and services across America. As you know, the past rounds have already resulted in a 37% decrease in HME rooftops since 2013, and the proposed rule would be pretty catastrophic for our industry. So it's more important now than ever before to weigh in with CMS to express your concerns with the proposed rule and how it impacts your business and your ability to serve your community. We want you to take advantage of the AAHomecare resources that can help your company submit your comments on the proposed rule. Make sure that you tell them how it impacts your business and your ability to serve your community. And if you haven't seen that yet, you can go to our advocacy and policy section of the website. It's aahomecare.org/2025 demipost proposed rule. And Tilly's going to put that in the comment box for you. But you know what? We're not the only voices that CMS needs to hear from. So in addition to submitting your own comments, we wanted to share some resources that you can use to educate and activate your communities and customers on submitting comments as well. I think end users and family caregivers are an often underutilized ally in our advocacy efforts, but they have a powerful voice because they're the ones that are directly affected by the policies in place. And when Medicare's proposed rule fails the very people it's designed to protect, we need end users and the public to join us in sending a loud and clear message. So we've been working with our allied consumer group partners to activate communities on the proposed rule, and we want to make sure that each of you also have the tools to do the same with your customers. So today we're going to walk through the end user competitive bidding activation toolkit so that you can put it into action and help make sure that the people you serve share their stories and submit comments to CMS on the proposed rule. I think the big thing for you all as your key takeaway is to say, how do I take these tools and put them in the hands of people who are affected by it, mobilizing them in our advocacy efforts? And, I'd had a conversation with a group earlier this week about the dynamics and who we're talking about in these end users and how this differs from the past. Today's end users aren't necessarily the same people that we used to serve. So you think about that like World War II Depression era generation that was willing to go without and they were afraid of speaking out. I know I had a lot of conversations back when competitive bidding was even being first expanded to the non-bid areas, or people were really having trouble, but they said, I don't want to say anything because I'm afraid they'll take away my Medicare. But today's Medicare population, which includes a lot of boomers and younger generations of people with disabilities, it's a totally different ballgame. These folks are more willing to self-advocate, and they are even more so motivated when they know that they're going to help speak out on behalf of maybe others who aren't able to themselves. So it's really important that we leverage these people. And, we've been talking to a lot of the leading consumer groups who are concerned about this impact as well and how they're talking to the communities that they represent. If you're unfamiliar with the ITEM Coalition, it's a huge consortium of over 100 national consumer groups. It's very engaged on this issue. In fact, they just hosted a nationwide learning session on Monday to educate their communities about the devastating impact of the program on access, choice, and quality of care. So we actually did share these resources with ITEM as well as our allied partners. We're just going to do a deeper dive with you all as you leverage them in your community outreach. So I am going to go ahead and pull up our website if you haven't seen it yet. One moment. I'll give it a second to show up. There we go. You should be able to see that now. So this is our competitive bidding activation toolkit page, and it can be found on our website. If you go under here, under the advocacy and policy page, you'll see that the proposed rule information for your company's information, but this is the one we're talking about for the end user resources, competitive bidding engagement toolkit. That's also the link up here, which is aahomecare.org/cbp-engagement-toolkit. So we're going to walk through each of these resources and how you can use them. And then we'll also have a sample email template that provides the suggested language that you can use if you want to send an email to your customers about these resources and can encourage them to take action. So you can see that this template is available right here if you just click right here. We have a couple of different tools that we've already designed for you. I'm going to talk about each of these in just a moment. But first, let's go on and start with the comment submission guide. So I'm going to pull that up for you really quick. So this is what this comment submission guide looks like. It's a 2-page resource, and it just teaches them about submitting comments, and it includes, the suggested talking points and asks. So at the top, you'll see that there is a snapshot overview of the proposed rule, just in case they haven't seen or understood it otherwise. It has prompts for comments. So that includes questions like what DME or supplies they use, how it would affect them if they didn't have access to their trusted supplier or had fewer options, or even if they had past issues under a previous round of the program. There's also suggested asks for CMS that they can ask to be revised about the rule. And it emphasizes the importance of submitting asks in your own words. And you've probably heard us talking to you about this as well. When you're submitting your company's comments, please be sure to put this in your own words with your own experience, because those that are just kind of like forms that look like it's the same language as everybody else, CMS will not be counting those as unique voices in this. So we talked to them about that. And then on the back side of this, you'll see 2 sets of talking points. One is addressing the importance of why product choice and service matter. And then there's also one on why supplier choice and expertise matter. And at the bottom section in red, there are step-by-step instructions on how to submit comments, and that includes a QR code that easily takes them to the Federal Register where they can click the green box and submit a comment. And if you haven't seen what that looks like yet, that's what this section is here. People would go submit a comment, and then they can put in their information here, or they can upload a file with their comments there. So that's what the comment submission guide is. I'd like to also show you the competitive bidding education overview guide, which I'll pull up right now. 1 second. There you go. And this is actually a 4-page guide. So this also provides that, what is competitive bidding at the top. But with over 270 pages of DME language in the proposed rule, there's no way that we could expect the public to review the language and really understand what this means to them. So instead, this is an education overview that breaks it down into 7 digestible topics. So you'll see the quick summary at the first page of how this affects them. It's more of that 10,000-foot view. But then in each of these subsequent pages, there's going to be a breakout topic. And so in that, you're going to see what that element of the proposed rule is and how that directly impacts end users. It has the little summary and then a call out box here on how this affects you, so they can directly connect what goes on and how this will matter to them. There are 7 different conversation topics in this. It addresses the reduction of suppliers, the unsustainable pricing, creating a trade-offs in care. It goes into things on inexperienced or unqualified bidders who may lack the knowledge or infrastructure to provide the safe care, the high-risk products in an untested program model. And then we get into the risks of losing that local support when issues or emergency arise, and how competitive bidding is not a tool to address fraud and abuse, even though the government says so, but instead it's posing hardship on the legitimate suppliers that our constituents need. And then lastly, but not least importantly, we have to talk about the ripple effect of competitive bidding on all end users, because as you all know, this is a program for Medicare fee-for-service, but what Medicare does is often the benchmark that other payers are going to use to set their payment and policy approaches. So we want to make sure they know that even if they're on Medicaid, or even if they're even with a commercial plan, this is something that could still affect them. So they should be engaged in speaking out. And I just wanted to highlight right here, we have a quote from one of our allied organization partners with spina bifida. And she had said, competitive bidding program puts costs over care, and that puts lives at risk. So know that we have strong voices joining us as we're calling out how harmful this proposed rule is. And I think that getting those different voices in this process, you'll see a lot of these are co-branded, just helps reemphasize this is not something that the industry is saying that nobody else agrees with. This is something that we're all really concerned with and working together to resolve. So we did the 7-topic overview, but if you go down just below, you're going to see these right here. These are breakout 1 pages. And so these are more for the new products that are being considered for the competitive bidding program. So we have resources on urological supplies, ostomy supplies, CGM therapy, and NIV therapy. And they each follow the same kind of 1-page format. So I'm just going to pull up the urological supplies one as an example for you. So this is what it would look like. It's going to have the competitive bidding summary at the top. There will be a section on why that product category is inappropriate for the bid program. And then there's that call out box on how this would directly impact end users, with a blue box below with that call to action and the QR code. And each one has a unique insight into why CMS should not put that program in the new program. And I encourage you to just read through this so you can see those talking points. But I just wanted to highlight a couple of those things for you all if you're not as familiar with this. But not only does CMS not have the authority to not add ostomy and urological supplies to the bid program, but the urological supplies were part of that Polk County demonstration project in the early 2000s when competitive bidding was just a concept. And CMS even acknowledged that it would be ill-suited for the program due to access concerns. And we also know that adding high-risk products to an untested model could have serious consequences. So if you look at CGM supplies as an example, they're going from over 800 suppliers to under 9 in the RID approach. That's seriously jeopardizing access to care and increasing the risk of hypo and hyperglycemic events. And of course, we also strongly oppose the inclusion of NIV and competitive bidding. It is a life-sustaining device that requires expertise and round-the-clock support. So you'll have each of those documents where you can reference that and make sure that you share these kind of tools with people that are using those products specifically. But lastly, I wanted to show you that we do have a short version of that. So this is our quick guide. I'm going to pull that one up. And so this is just a one-pager. And if you were going to, for example, print this and put this out with people, this might be a way that China captures it at high level. So you'd still get that summary of what's going on with competitive bidding. Those 7 topics that we talked about before are right here referenced. It's just less detail around them. So you get those key things there. And of course, that call to action at the end. So those are all tools that you can use that just kind of teach people more about the program itself. But we also wanted to help you raise awareness by social media posts. So we have a series of different posts that we've created. One set of them is for our industry to share on each of your social platforms. And the other one is to actually share with end users along their networks. And each set is going to have 3 central themes. So the first one is on access and choice. The second one is on inexperienced suppliers. And the third one is on quality products and services. So let me just show you the 3 for our industry. You can see them right here. They each have a sample text that you can use. And so you'll just kind of go down here. You can see the sample text. You're welcome to use or edit it as you see fit. But importantly, each one of these asks that viewers submit comments with their concerns by the August 29th deadline. And depending on which social media platform you're using, it might be helpful for the algorithm if you actually post the link where they can submit comments as your first comment. So if you'd like to do that, you're welcome to. I did provide a tiny URL link. So if you wanted to use that, you can. It's just a shorthand link. It still directs people to that Federal Register page, but it's a little bit shorter than the one that's, a mile long with all the details in it. In addition to these 3 posts, like I mentioned, we do have some posts to share with end users as well. And so I did not put comments like suggested text for those because I really think this needs to be them and their own voices doing it. But you can see that these are more written in that first person perspective, expressing their concerns with the program and how it would affect people like them. So these are the tools that you all have available. And then I just wanted to help you understand a couple of things that you might want to do with it. So one, you could share the educational resources that we just discussed with your customers. And that might look like sending them via email, like that template we just talked about. Or it could be that you're teaching your customer service reps or your delivery technicians or your therapists or any kind of customer facing staff about the program and the tools, and then helping them mobilize customers into action. Or it could be that you want to upload these resources or just take talking points from it and put it on your website, and then have a link on your website where viewers can take action. The second thing you might want to consider doing, of course, is to post those social media graphics with that call to action. Make sure that they submit comments and highlight that across your social media platforms. And then the third thing is just to reach out to your local consumer groups and support groups, especially if you already have a relationship with them. You want to educate them about the program and you want to ask them to share resources with their respective members. But keep in mind that the deadline to submit comments is August 29th, so we have to act quickly. That's only 15 days from now. So I encourage you all to share these tools and activate your customers as quickly as possible. And of course, be sure to also submit your comments as well. CMS has to hear from a variety of different stakeholders, and I really feel like together we can send a powerful and united message about the urgent need to address these serious flaws. I want to thank the brand council and the AA Home Care team for their support in helping with this campaign. Our goal is to empower every stakeholder to take action and make sure every voice is heard and counted. If you do have questions about this, or for those who are watching on the recorded line and they're not able to ask questions right now, you can always reach out to us at info@aahomecare.org. But with that, I'm going to stop the screen share and open it up if anybody has any questions.
Ashley, I'll go ahead and start it because we received a question. Are everyone's comments publicly available?
For those who are submitting comments on the Federal Register, they are. And in fact, you'll see on there are certain guidelines for what you should do. So I did put in the educational resources for end users to make sure that they don't include personal identifiable information. So don't put your name, don't put your Medicare number, things like that. But just know that whatever you all are submitting, this does go on public record. You can actually see the comments submitted so far. There's well over 2,000 at this point. And you're welcome to go through that. If you go to that page, you can actually see the details for that. Great question.
One more we received. What's the most important issue we should ask patients or anyone to cover in their comments?
I mean, really, it's access and choice, right? I mean, this program is going to take away the HME infrastructure that all these people rely on to manage their needs at home. And so there might be different pockets of this that people care about. And maybe I use urological supplies and I'm worried about my risk of CODIs going up if I have something like that happen. Or I could be using oxygen therapy and have a completely different need for what I'm going through. But I think it's just important that they understand that they're losing access to the choice of supplier that provides the quality support that they need. They may have reduced products that are available to them because of the limitations that we have. And the one thing I should also note, I think a lot of the consumer groups actually understand that we can't afford to provide what we would love to be able to provide when we're getting paid in the red for what's going on. And they understand the problem with speculative bidding and how that can drive prices down below what's sustainable. And if you look at the proposed rule right now, for some of the ways that they're artificially limiting the cap of what the bid ceiling should be, there are a lot of reasons why that will drive down what that product choice will look like or who the suppliers will be in there. And I think that would be something that if we can talk about that in a way that connects that end user with like, oh my gosh, I want to be able to use ABC company because they take care of me and they answer my calls and I feel really comfortable. And I know that I'm going to be taken care of with that. Or I need this particular product because I have unique medical and physical needs, and I need to make sure that this product works for my lifestyle or for my body. And this removes that choice. Healthcare is not one size fits all. If we can find a way to take those main messages and give it to them in a digestible way, I think they can help articulate that patient access and choice key drivers. Good question.
Ashley, we also received one about whether the resources will be shared and the info shared with our state associations. Thank you, Lauren, for answering that one through the chat. She said she will be sharing it, but I believe all state association leaders will be receiving the recording. If you want to
Yes.
mention anything further on that.
Yeah, this was a much bigger response. We actually maxed out of our capacity on there, even though we did upgrade. So glad to have everybody on here. We are going to send the recording out. I will send it to all of our councils and, of course, to our state leader partners. State associations have access not only to this recording, but to all the toolkit. And we did get coverage in trade press as well. So as much as you can do to help us turn up the volume in the next 15 days, we appreciate your all support in that.
We do have a question about, let me just go through these. Let's see. Is outreach being done to physician groups and hospital systems? This will delay discharges and lead to more readmissions if
Yeah,
access is severely reduced.
and any of those relationships that you have, I lean into those because that can't be the first time you show up at their door and you say, hey, we've got this catastrophic thing. Please believe me. By the way, my name is Ashley. It really helps if you actually already know these places and you've built that relationship. But yes, and even on the Item Coalition webinar on Monday, they had WOCN, which is a clinical organization for the Wound Continence and Continence Society. They were on there talking about the impact this will have as well. And I'm aware of several other clinical groups who are activated on this issue.
We also have a question about NIV and whether it's formally in the competitive bidding program. Ashley,
Yeah.
you may want to answer, but we are just confirming with Jay and Tom before we respond, but John will definitely get back to you.
Product categories are not going to be announced yet, but we know based on past rounds that they had considered doing so. So I think that we would be staying tuned to that. Kara, I know I see that you're on the call as well. but product categories have not been formally announced, but we do know that it was under consideration in the last round. And of course, with the public health emergency and with the outcry from all the different stakeholder groups, they did not wind up including it in that last round. Kara, did you have anything you'd like to add?
No, that's exactly right, Ashley. So yeah, they have no product categories have been officially announced, even though CGMs and medical supplies are definitely noted prominently that they are likely to be included. But we would expect CMS to separately announce via sub-regulatory guidance the products that will be included.
Mm-hmm. Mm-hmm. And also, I think some people have been asking us, but we don't know what the timeline is going to look like. If you look historically, we should expect the final rules sometime in early November or in November. We may get some sort of additional information by the beginning of the year, but at this point, we don't know yet. But just make sure that if you're subscribed to AAHomecare alerts and communications, especially if you're an AAHomecare member, we will be getting these things out the door as soon as we find out information. So you'll be the first to know, and we'll keep you posted on everything. Any other questions? These are great. Okay. If anybody needs any assistance, please reach out. You all, I think I see a lot of familiar names and faces on here, but you can reach out to me or also reach out to our team. Again, that's info@aahomecare.org. I would be remiss if I didn't say this. Obviously, no margin, no mission. If you can help us by becoming a member, if you're not, that helps us amplify our advocacy efforts. We are all hands on deck working to address not only competitive bidding, but a host of other issues that are impacting our industry. And having your all support really amplifies our advocacy efforts. So I want to thank all of you who are members for showing up and walking this out with us. And if you're not, we encourage you all to get engaged. But with that, I can close this out. Thank you again for your all's time, and be sure to submit your comments by the 29th.